our topic is Ebola and global epidemics, or how it relates to a global epidemic. And so first we have our first visual, and it is basically the spread of Ebola, and it's most common in Africa for different reasons, in the Democratic Republic of Congo, Nigeria, Senegal, Guinea, Sierra Leone, Liberia.
And this is just as of October 10th of 2014, so some of it isn't completely accurate, some of it has changed, but as we see in the United States, there was one case and one death. In Brazil, 4 suspected cases, and like she said, in West Africa, there's a lot more. Like in Guinea, there's 1,350 cases, 778 deaths. In Liberia, 4,076 cases, and 2,316 deaths.
And we're going to get to why exactly it's more in Africa than it is in other countries in our PowerPoint. So, the Ebola virus disease, or EVD, first appeared in 1976 in 2 simultaneous outbreaks, one in Sudan and one in Democratic Republic of Congo, near the Ebola River, which is how it got its name.
And it has killed over 11,130 people, and it occurred in 6 different countries, in Nigeria, Liberia, Mali, Sierra Leone,
and the U.S.
recently.
It's transmitted through human-to-human contact, so it's not airborne, and its current survival rate is 50%. So here's another map. It just explains, you can tell in red it's more, down at the scale, and then in other places it's less.
So EVD, or the Ebola virus disease, is a part of the Filoviridae virus family, and that family has 3 genera or subdivisions, and those are the Cuba virus, Marburg virus, and the Ebola virus.
And the Ebola virus has 5 species. So you can tell, there's a recent outbreak in 2014 in the West African region, and it's been worse than any virus or Ebola outbreak in the past. Since 1976, it's been the worst in 2014, and it belongs to one of the 5 species, which is the Zaire species. So.
Some recent outbreaks, there was one in Western Africa in March of 2014, and that was the biggest outbreak in history, and as it says, the CDC has sent teams of public health experts to try and help control it.
Yeah, the CDC is Centers of Disease Control and Disease Control and Prevention. It's U.S., so as you can tell, we're already stepping in and helping. So August 24th, 2014, they decided, she died on August 11th, 2014, but she was, she was pregnant, she was living in the Democratic Republic of Congo, this woman, and she became ill after, having contact with an infected animal, and that's how they kind of just, realized that was one of the, ways that Ebola virus spread is through infected animals. And after her death, there was 49 following her and 66 cases in total.
The transmission, how it spreads, scientists think that it first got into contact with humans by infected animals, like that pregnant woman. She butchered a bush animal, and that's how the disease got to her.
And then from her, it spread human-to-human contact through, broken skin, so blood. In Africa, they lack health systems, strong health systems. So oftentimes, they're treating patients with Ebola. They are using needles and syringes that hadn't been properly cleaned. And so if you use it on one person, then you don't properly clean it, and